I'm Joan. I'm 46, and I've been struggling with fatigue and low energy, stomach feeling bad, and but in the course of coming to Dr. Green and using the therapies and going on the autoimmune diet, I really have lots more energy. I feel better. I feel much more positive about the outlook of my future. I was feeling very old at 46. I really felt 46. I'm feeling back to, energetic, and I can exercise. I'm doing my yoga more, and just feeling much, much better.
So you mentioned, you had trouble kind of remembering what you were suffering from.
I did. So that's another, that's another piece. Brain fog, big thing. It's getting better, not perfect, but brain fog. Memory, getting better. And a lot of those, the fact that I couldn't remember a lot of things, my memories kind of drove my stress levels, which then kind of drove my immune system to react. So my stress has actually been reduced a lot just because I'm feeling better.
More recently, you've had some issues and you've seen another doctor. And share with us kind of, maybe the pains that you were having, what the doctors even suggested, and where you are now today.
Right. I've seen a couple doctors. One of the doctors that I've seen is my OB-GYN, and she took a look at some of what's going on with some pain I have in my ovaries. And she suggested one thing, which was to go purely on purified water and to use no water other than that. And she also said to kind of not jump into surgeries and jump into anything for those cysts, and to really work with FCT and with Dr. Green. And I'm excited that she supports this.
So you've done that, and you were just telling me that some of the symptoms have already changed.
Right, some of the symptoms have already changed. In fact, between Dr. Green, but also they've changed in terms of my pain. So doing the FCT, and just for the last 2 weeks, the pain in my ovaries, I have not had any outbursts of pain for 2 weeks now.
And prior to that, how frequent was the pain?
The pain was frequently daily. Daily, every other day. Was it good?
If somebody's wondering about whether they should make the change to do something that's maybe a little unorthodox, or go down this path of an alternative or integrative approach towards health, what would you tell them if they weren't quite sure?
If they weren't quite sure, I would say they need to do your research, because you have a wonderful website and there's so much to watch. That's the first thing I would say, to watch all of the videos and talk to other people like me, people that have gone through it, and jump in full force. Just do it. Because doing it partially, which a lot of us have done in the past, I did gluten-free before coming to Dr. Green, but just really embracing it, giving it your best shot, and being committed.
Well, great. Thank you very much.
Yes.